We offer you these four core features. We have live classes in which the educator comes online and they teach you everything online live. And you can log into these classes and get any of your doubts clarified. You will have the educator online who will clarify your doubts then and there. And if you haven't understood anything, you want something more, you always have recorded versions which you can go to. And these videos are really good and they are very crisp and concise and gives you maximum information. Then we also have notes which are based on the recent CBME curriculum, and it has so many diagrams and question answers, MCQs, and everything which will help you to ace your exams. Then we have MCQs available in the app, which will help you for your upcoming next examination, which is bound to happen in a couple of years, and these features are really going to help you in your entrance exams as well. Then we offer personalized counseling sessions for you guys, in which you will be given a mentor, and that mentor will be like your buddy. You can share any of your concerns with them, whether academic or non-academic, and they will analyze your strengths, your weakness, and where you're going wrong, what you're doing wrong. All of these things will be analyzed by them, and they'll give you a study plan, and you can utilize the study plan and stick to it and make sure that you pass all your entrance examinations. And we offer three different subscription models. In the basic plan, you have pre-recorded sessions, you have live class and live doubt clarification sessions, and quick revision exam videos. In the standard plan, you have pre-recorded classes, live class, live doubt clarification, and quick revision exam modules. But premium plan is the one which is all-in-one plan, where you will be having access for everything: pre-recorded classes, live class, live doubt clarification, one-on-one guidance, notes, and everything. And you can use my coupon code Dr. Sushma 20 for any additional discounts across all three subscription plans. Okay. Yes, with that, I'd like to start today's class, where we'll be studying about the cadaveric image discussion. Okay, very, very important. In this class, so many concepts come together, right? Whatever you have learned in your in these 10 classes in neuroanatomy, all of the concepts are going to come together in this class. So it's like more like integration of whatever we have learned, and we will consolidate everything in today's class. Okay, yes. Before I start, I'd like to explain these sections, how we actually dissect a brain. Okay, let's say whenever you give me a specimen, right, I have certain planes of dissection, right? I cannot randomly chop it. I cannot randomly take any organ in my hand and I cannot, chop it like a butcher. I cannot do that. There are certain planes in which I have to take dissections so that I can see maximum structures, right? I can see maximum structures. And these are the three different planes in which sections are taken. And it is more important when it comes to radiology as well. Because if you don't know what section you are looking at, you will not understand what structures you are seeing over there. This is more so, sorry, this is especially holds true for CT and MRI images. You should know what section CT or what section MRI is actually being seen. Okay, so that is the importance of knowing what cut section I am taking over here. So the first section is sagittal section. So what is the sagittal section? Imagine I'm holding the brain in my hand like this. Correct? How can I cut the brain? I can do a section like this. Correct? If holding the brain like this, I can do a section like this, or I can do a section like this, or I can do a section like this. Understanding three planes, holding the brain in my hand like this. Imagine there's a brain in my hand. What are the three different sections I can take? One, I can take a section like this, or I can take a section like this, or I can take a section like this. Three different planes in which I can take different cut sections. So the one in which I'm taking a section like this is the coronal plane. How do we know? How do we wear the crown? We wear the crown like this, right? If I take a section like this becomes the coronal plane. Next, if I take a section like this, what is this? Which is going from side to side. It is horizontal plane. Correct? What if I take a section, I hold the brain like this and cut it in the half and look at it from the side? I hold the brain like this, cut it into half, dissect it into half, and I'm looking at from the side. So that is this the sagittal section. So there are three different planes of dissection that I have. Okay. One is the coronal plane where the section is taken like this. Second is the horizontal plane where I'm going to take a section horizontally like this. Third is the sagittal plane where I have the organ that I'm studying in my hand like this, and I'm cutting it into half and I'm seeing it from the side. The side section that I'm taking is the sagittal plane or the sagittal section. And brain and the structures at each of these planes look different. So that's the whole point of taking this different dissections planes, so that I know how the brain looks across these different sections and what structures are seen. Okay, understanding, you should know this, then only you will understand the different structures. All right, let's go. So this is the first diagram that I'm taking today. This is the first diagram that I'm taking today. Okay, let's look at this, guys. What is the plane, or how do you think I'm looking at this brain, or how do you think I'm looking at this particular section? What have I done is I have taken the organ and I'm seeing it from the inferior section. I'm seeing it from inferiorly. Suppose I'm holding the brain like this. How does it look from behind? From below. Hold the brain like this. If I have to see the brain from the inferior section, this is how it looks. This is how it is going to look if I see the brain from below. Right? So before going to identification of all these nerves and everything, let's just try to identify what different structures of brain that can be seen over here. So the whole point of learning these two diagrams is to identify cranial nerves that are coming out of this midbrain pons and medulla. So that is the goal of understanding this two diagrams or these two images that we have over here. What are the different things that I can see? See, one thing I can see over here is the first thing that I can see is the temporal lobe, right? This is the temporal lobe. Then I can see some yellow things over here. Those are all the cranial nerves. Then what else can we see? I can see the infundibulum here. Okay. And I can see these round elevations over here, which are the mammillary bodies. Correct? Then other than that, what else can I see? I am seeing this structure over here, which is the pons. Also, I can see the medulla oblongata here, in which this is the pyramid and these are the olives. Agree? This is the pyramid and olives, correct? Then I also see cerebellum. Have I cut any peduncles here? No, I haven't cut any peduncles here. So all the peduncles are intact and this is the cerebellum. So obviously this, wait a second, I'll just. Obviously, so this aspect will be the frontal lobe, correct? This is the frontal lobe. This is the temporal lobe. This is the infundibulum pituitary stalk, and this is the mammillary bodies. And this aspect is the midbrain. This is the pons. This is the medulla oblongata and cerebellum. Understood? Understood. We have identified different parts. All right. Then let's come to how the cranial nerves are exiting the midbrain cavity. Correct? Sorry, how the cranial nerves are exiting the brainstem, which I have repeated so many number of times up until now. In the entire brainstem, I have three different structures. What are the structures? I have the midbrain, I have the pons, and I have the medulla oblongata. Correct? I have midbrain, pons, and I have medulla oblongata. Right? So, what are the different nerves that come out of the midbrain? What cranial nerves come out of midbrain? I have third cranial nerve. I have fourth cranial nerve. Then, where is the fifth cranial nerve present? Fifth cranial nerve is present on the body of the pons, where it has a very big sensory root and a small motor root. Okay, this is the fifth cranial nerve. Then in the pontomedullary junction, I have 6, 7, and 8 cranial nerves coming in an order. 6, 7, 8 are present in an order in the pontomedullary junction. Then, if I come to the medulla oblongata, I have the pyramid and the olives. Between the pyramid and olive, I have 12th cranial nerve. So, what was the mnemonic for that? Mnemonic was 4, where P is the pyramid, O is the olive, H is the hypoglossal nerve, which is the 12th cranial nerve. And lateral to the olive, I have 3 more nerves coming out, which are my 9th, 10th, and 11th. Right? So, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12th. 12th comes between olives and pyramids. Correct? Yes. Now, what is left out? First and second cranial nerves. First is the olfactory nerve, which is extremely anterior. Second is the optic nerve, which clearly I can see the optic chiasma over here. So, this is how the cranial nerve distribution is seen from the inferior aspect of the brain. Understood? Understood. So, if you have understood this rough sketch, then we'll try to mark the same structures over this diagram. We'll try to identify the same structures over these two pictures. So let me erase it for you, whatever I have written here on this diagram, so that I can, we can identify all the different cranial nerves that are coming out. I hope you have identified all different structures of the brain. And now we are going to point out where these cranial nerves are situated over here. So always, guys, whenever you are confused, start with the optic chiasma. So your first, whenever you look at a diagram or a picture like this, you always have to start with optic chiasma, because optic chiasma is very evident, right? So where do we start our identification from? We start our identification from optic chiasma. This X structure where optic nerves cross over each other is the optic chiasma. Correct? So we are done with this structure. Optic chiasma we have identified in this diagram. Then anterior to the optic chiasma, what do I have? I have olfactory nerve, which is entering into the cribriform plate over here. You can see. So this structure is also done. Next, in the midbrain, what are the two nerves that come out? We have third nerve and we have fourth nerve. And we all know fourth nerve is the only nerve which comes from the dorsal aspect of the midbrain, correct? So third nerve comes from the ventral aspect. So you can see it starting straight away in the midbrain. And the fourth nerve is coming from the dorsal aspect. So we've identified both third as well as the fourth cranial nerve. 1, 2, 3, 4. 4 cranial nerves are done. Then come to the fifth. Where is fifth cranial nerve present? It is present on the body of the pons. In this picture, where do you see the body of the pons? The body of the pons is here. Identifying the body of the pons. So what is that big nerve that I see over here? This is the fifth cranial nerve. As you can see, I have a very big sensory root and a small motor root. On the body of the pons, I can see the fifth cranial nerve that is clearly visible here. And come little lower down. This is midbrain, this is pons, and this is medulla. Midbrain, pons, and medulla. Between the pontomedullary junction, I have 6th, 7th, and 8th cranial nerves. All these nerves are present in one order. So this is the 6th cranial nerve, abducent nerve. This is the 7th cranial nerve. From medial to lateral, I have this is the 8th cranial nerve. Identified it. Look at it, guys. On the other side, I'm showing. So this is the 6th cranial nerve. This is 7th cranial nerve with a big motor root and a small sensory root. And this is the vestibulocochlear nerve, which is coming out from the pontomedullary junction. Then come to the medulla. From the medulla, I have 4 nerves coming out. This is the pyramid. Correct? These are the olives. Pyramid and olive. Between pyramid and olive, what is the one nerve that I have which is coming out? What was the mnemonic? PHO, 4. H is the hypoglossal nerve. As you can clearly see, between pyramid and olive, I have hypoglossal nerve. After hypoglossal nerve, I have 3 more nerves, which is 9, 10th, and 11, which are actually coming in one order. As you can see, this is glossopharyngeal, this is vagus, and this is accessory nerve. You can see accessory nerve, the spinal part is coming from below. This is the accessory nerve. Understood, guys? So if you have this basic understanding, you can replicate the same thing over here and try to mark these structures. Very easy, very easy. Nothing at all here. Students find it so complicated. It is not. First, you should understand this. Then you can mark these nerves over here on the cadaveric image. Let's take one more example. There's an actual section in which I can see first, always, what is the rule? Always identify optic chiasma. Then this is the olfactory nerve, the one that is anterior to that. Then after that, identify the big body of pons. Now above that is the midbrain, right? From the midbrain, I have 4 nerves. Medial one is the 3rd cranial nerve. More lateral is the 4th cranial nerve, trochlear nerve, which is more dorsal also. Then this big nerve that I can see over here, which is present on the body of the pons, is the trigeminal nerve. Then come to the pontomedullary junction, where I can see this is the 6th cranial nerve, this is the 7th cranial nerve, this is the 8th cranial nerve. 6, 7, 8, which is present in an order over here in the pontomedullary junction. Then come little over down. What do I have? This is the pyramid. Olive has been removed. So between pyramid and olive, I have one nerve coming out like this, which is the hypoglossal nerve. Then 9th, 10th, and 11th, which is present in one order. As you can see here, this is the 9th cranial nerve. This is the 10th cranial nerve, and accessory nerve coming from below. You can see accessory nerve this side as well. This is how you mark up different structures. This is how you mark up different structures in any aspect, right? First, you have to identify this rough sketch. If you know this rough sketch, you can replicate the same thing over here. So the order how you have to learn the cadaveric images, first make a rough sketch in your head. This is how this section looks like. You should have an imagination. Then look at an atlas image. This is an atlas image. Once you've understood the atlas image, then come to the cadaveric image. Because in cadaveric image, now you don't have these yellow colors for nerves. It is all white. It is all pale. First, identify the rough diagram, then come to the atlas image, and then come to the cadaveric section. Then only you will be able to understand. Okay, let's go to the next diagram. So again, as I said, this is the midbrain. This is the pons. This is the medulla. In the medulla, I have pyramid and olive. Between them, I have 12th cranial nerve, right? This is the midbrain and this is the pons, right? And I have optic chiasma here, and I have 1st cranial nerve olfactory, and this is 2nd. 3rd and 4th comes from here. 5 is present on body of pons. 6, 7, 8 comes from PMJ, pontomedullary junction. Then this is pyramids and olives. Sorry, this is also pyramid, and this is the olive. Lateral to the olive, I have 9, 10th, and 11th cranial nerve, which comes out. Okay, understood this? Yes, let's go to a different section. Again, same section. Let's just label the nerves over here. This is the 1st cranial nerve, 2nd, 3rd, 4th, 5th, and 6, 7, 8 in one order. And this is the between pyramid and oil, 12th, 9th, 10th, and 11th in one order. Okay, and let's also try to identify what different structures that I can see over here. Okay, what do I see? I can see these rounded elevations, which are mammillary bodies. I can also see that this is the tuber cinereum. Then I can see these 2 peduncles, guys. What are these 2 peduncles? These are the crus cerebri. Remember, crus cerebri, which is also called as cerebral peduncles. Correct? This is the midbrain area. This is the crus cerebri, and you will also see the posterior perforating substance here, and this entire area is what is called as interpeduncular fossa. If you remember, I had taught you about this interpeduncular fossa while teaching midbrain. What are the different contents and what are the boundaries? You can see optic chiasma here. This is the tuber cinereum. These 2 are the mammillary bodies. And then you have the posterior perforating substance over here. And then the 3rd nerve that comes out. So this entire, and then we have the 2 crus cerebri like this, as you can see in this diagram. So this entire thing is called as interpeduncular fossa. And here I have the anterior perforating substance, if you remember. Correct? Anything you're able to correlate what we had learned in the very first class of neuroanatomy, where I had taught about midbrain. Are you able to correlate? Yes, this is the interpeduncular fossa. Let's go to the blood supply of brain and try to see where all of these arteries will be running. Okay. Now, what is the blood supply of brain? Blood supply of brain mainly comes from two: vertebral system and carotid system from ICA. So, two vertebral arteries join together to form internal carotid artery. So, it's become tall. Sorry, two vertebral arteries join together to form the basilar artery. It's not tortuous, it's actually straight. I'm sorry. Two vertebral arteries join together to form the basilar artery. Next, basilar artery divides into posterior cerebral artery. Correct? Further, I have the ICA here, internal carotid artery, which gives rise to posterior communicating artery. Further, it also gives a branch which is anterior communicating artery, anterior cerebral artery, which are joined together by the anterior communicating artery, and ICA continues as MCA, which is middle cerebral artery. Okay, so this is a rough sketch. No? This is how the entire system of blood supply to the brain is. What are these arteries? Vertebral arteries, which join together to form the basilar artery. Then we have the posterior cerebral artery. Basilar artery divides into posterior cerebral arteries. Then we have ICA, which gives a branch which is posterior. Okay, sorry. I don't know why the call got dropped. Please let me share the screen.
Ma'am, please try now.
Yeah, it's work. Just hold on a second. Okay, so this is how the vertebral artery and ICA communicate with each other and forms a circle of Willis. Now let's see how this formation actually takes place. So the two vertebral arteries join together to form the basilar artery, which runs on the body of the pons, and it gives rise to posterior cerebral artery. Correct? Then here I have the ICA. Here I have the ICA, which gives rise to the posterior communicating artery, and then further it gives a branch which is the anterior communicating artery. Here you can see the anterior perforating substance which is present here. And PPF is present over here, posterior perforating substance. I hope you remember about them. And there is one more artery which is called a superior cerebellar artery, which run over here, right? This is a superior cerebellar artery which runs, and third and fourth nerve, you can see they emerge between this superior cerebellar artery. So if this is the PCA and this is the superior, this is the superior cerebellar artery, correct? And third and fourth nerve, they emerge between these two. So this is how the different parts of the arterial system of the brain run. So the basilar artery actually runs over the pons. This basilar artery actually runs over the pons. Okay, so this is the arterial system, and you can see how different nerves are also there, and you can see how this artery supplies different aspects. Okay, then let's go to a very, very important aspect. This is the osteology of cranial cavity. Very, very, very important, guys. There is no way you can go to exam without studying this. One question is for sure in your practical exam. All right, yes. Now let's try to identify different structures. Have a good look at this particular diagram, a particular picture, and then we'll try to replicate the same in another picture. Okay, look at this. The first one I see over here in the anterior cranial fossa is the foramen cecum. Then I can see this dot 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 structure, which is the cribriform plate, right? Cribriform plate. Then I have, when you come to MCF, identify the anterior clinoid process here. This is the anterior clinoid process, and the foramen which is next to it is the optic canal. Then the one that is there, you can see something like this, sort of a moon-shaped thing over here. That is a superior orbital fissure. Then you have 3 foramen in one line. Okay, 3 foramen in one line, and that is foramen rotundum, foramen ovale, and foramen spinosum. Foramen rotundum, ovale, and spinosum. And the one which is present most medially, this is the foramen lacerum. All right, then come to PCF. Here, what do we have? I have a big foramen, which is the foramen magnum. Next to foramen magnum, you see a very chotu foramen like this. This is the hypoglossal canal. Then again, you are going to see a very big foramen over here, which is the jugular foramen. Then next to it, I have internal acoustic meatus, which is internal acoustic meatus. Okay, let's try to replicate the same in the next picture, and then we'll see what structures pass through these different foramina. Yes, guys, let's try to replicate the same. Always start from above. So what is this foramen that you are seeing? This is foramen cecum. Then what is this dot 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 thing that you are seeing? This is cribriform plate. Okay, just hold on a second. Let me connect it to the charger. This is the cribriform plate. All right, this is the cribriform plate. Then after that, the next thing is to identify the anterior clinoid process. Once you identify the anterior clinoid process, what is this foramen? This is the optic canal. Optic canal. Then this structure that you can see over here, you can see on this side also, it is the superior orbital fissure. After this, 3 foramen in one line. 3 foramen in one line. What is this? Foramen rotundum. This is foramen ovale. This chotu one that you see over here is foramen spinosum. Then this medial one, the most medial one that you can see over here, is the foramen lacerum. Understood? Identified it easily? Yes. Come to the PCF. Here, what do we see? This is the biggest one, which is the foramen magnum. Then the chotu one that you are seeing over here, the chotu foramen that you are seeing next to the foramen magnum is hypoglossal canal. Then what is this big foramen that you are seeing over here? This is the jugular foramen. And then the next to it is the internal acoustic meatus. This is how you identify different foramina. Okay, once you identify different foramina, let's just try to understand what are the different structures that actually pass through it. All right, so the first is the foramen cecum, not very important, only emissary veins pass through it. Cribriform plate, axons of olfactory nerve, not very important. Optic canal, no points in guessing, optic nerve. Superior orbital fissure, you have many structures like V1 passes through this, and you have trochlear nerve which also passes through this, frontal nerve, and so many structures passes through SOF. Foramen rotundum, very important, V2. Foramen ovale, the mnemonic is male, M-A-L-E. Ovale is male. So what is this male? M is mandibular nerve. A is accessory meningeal artery. Then L is lesser petrosal nerve. E is emissary vein. Very important, guys. Generally, it is the foramen ovale which is asked because you have all of these four important structures that pass through it. Then foramen spinosum is related to middle meningeal artery and nervus spinosus. Nervus spinosus. Then foramen lacerum. Again, so many structures actually pass through foramen lacerum that I'm writing here. Important one is ICA. Remember, ICA enters through foramen of lacerum and then enters the cavernous sinus. And after this, through the foramen lacerum, I have emissary veins. Then I have pharyngeal artery, main pharyngeal artery, then deep petrosal nerve, and I have greater petrosal nerve. Deep petrosal and greater petrosal nerve, all of these structures are very important. Next, internal acoustic meatus. Name only says it has to be something related to what? Ear. Correct. Now, what is that one nerve that entered the middle ear cavity and then it took a genu where the geniculate ganglion was present and then it entered the middle ear cavity, became straight and it, curved through the promontory. What is this nerve? This is seventh cranial nerve. So, 7. And of course, because it is, we are talking about ear, what is the nerve that actually is concerned with balance, hearing and everything? Vestibulocochlear nerve, and of course labyrinthine artery. So these three structures pass through internal acoustic meatus. Then come to the jugular foramen. Guys, when I say jugular foramen, what comes to your mind? Jugular vein, internal jugular vein. So what two structures form the internal jugular vein? What two structures form the internal jugular vein? I've already taught you this in dural venal sinuses. One is my inferior petrosal sinus, IPS officer, remember, and also sigmoid sinus. Inferior petrosal sinus and sigmoid sinus together, they form the jugular vein, internal jugular vein. Correct? Yes. After this, between them, I have 9th, 10th and 11th cranial nerve that come out together through the jugular foramen. Let's try to understand, guys, why 9, 10, 11 is coming. If you go to the previous picture, this picture, you can clearly see the 12th cranial nerve is between pyramid and olive. Whereas 9, 10, 11 are lateral to olive and they are coming out separately in an order. Correct? So 9, 10, 11 is a bunch which is sticking together, and the same 9, 10, 11 cranial nerves, they come out through the jugular foramen. Whereas the 12th cranial nerve has a separate canal for itself, which is the hypoglossal canal. Are you able to correlate now? Are you able to understand how these different nerves are coming out of the cranial cavity? Right? 9, 10, 11 were lateral to the olives. 9, 10, 11 together, they come out of the jugular foramen. Whereas the 12th nerve, which is coming out between pyramid and olive, is coming out of the cranial cavity through the hypoglossal canal. Then what is left out here? Big foramen magnum, have the vertebral arteries and the spinal cord. Understood, guys? Understood how different cranial nerves are exiting the cranial cavity, right? Now, cribriform plate, axons of olfactory nerve, which is the first cranial nerve. Optic canal, second cranial nerve. Third and fourth comes out of the superior orbital fissure. Fifth cranial nerve, V1 is coming out of SOF, V2 is coming out of rotundum. What's the issue today? Everything looks fine at my end. Please let me share the screen. Let me share the screen, please. All right. So, are you able to identify how different cranial nerves are coming out of the cranial cavity? Right now, let's just look at it again. So, the first cranial nerve, the olfactory, is coming out of cribriform plate. Then I have the through the optic canal. Now I have optic nerve, which is my second cranial nerve. Then what else do I have? The third and fourth is coming from the superior orbital fissure. Trigeminal nerve has three parts, V1, V2 and V3. V1 is coming out of superior orbital fissure. V2 is coming out of rotundum. V3 is coming out of ovale. Sixth cranial nerve does not come out of any of this foramina, guys. It actually pierces the dura and then come out of the duralos canal. If you remember it, if you remember the sixth cranial nerve, then why is it very susceptible to any, whenever there is a subarachnoid hemorrhage or whenever there is a raise in the intraocular pressure, sixth cranial nerve is involved more because it pierces the dura and then it comes out. Okay, that is how the sixth cranial nerve is coming out. And then I have the seventh cranial nerve, the facial nerve, which is coming out of internal acoustic meatus, 7 and 8. Then the 9th, 10th and 11th is coming out of jugular foramen. 12th cranial nerve is coming out of this hypoglossal canal. This is how different cranial nerves come out of different foramina. Very, very, very important. Okay, let's just try to write what different structures are coming out and revise it again. Foramen cecum, not very important. Then I have the cribriform plate, through which I have axons of the olfactory nerve, which comes out, optic canal, second cranial nerve, which is my optic nerve. Then I have the superior orbital fissure, third, fourth, and so many different structures that come out of it. Rotundum is V2, foramen ovale is male, foramen spinosum is middle meningeal artery, and nervus spinosus, jugularis, 9, 10, and 11th cranial nerve, along with inferior petrosal sinus and sigmoid sinus. Then hypoglossal canal is 12th cranial nerve, internal acoustic meatus is 7th, 8th and labyrinthine artery. Foramen magnum, spinal cord and vertebral arteries. Understanding this, guys? Understanding? You want to, if you want to, point out these things again, if you want to mark these things again, let me just do it on one side. All right. Somehow it's not working. Yeah, because maybe I had written it the previous session. Okay. So this is how different foramen, and this is how we have to identify different foramens, cranial nerve foramen, cranial cavity foramen, and you should know how the different nerves are coming out. First, always identify the cribriform plate. Second, identify this clinoid process, this, and then identify the optic canal. Then three cranial foramina in one row, which is Ross in the order rotundum, ovale, and spinosum. Then we have this lacerum, and then this is the big one, is the foramen magnum. This is the hypoglossal canal. This is jugular foramen and internal acoustic meatus. Very, 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 very important. I cannot stress this enough. You will get one question for sure in this. Sure, short question. If you know this well, if you have identified the foramina, know the structures, it's going to help you a lot. Now, let's go to one more section. What is this section, guys? What is this section I'm taking? I'm looking at the brain like this. This section is the coronal section. Coronal section. You should identify different structures over here. That's it. So what is this white matter fiber that is going from one side to another? This is corpus callosum. What is this two horns which is coming out like this? This is my two ventricles which are lateral ventricles, which are converging to form the third ventricle, right? And what is this white matter bundle that is coming like this and radiating into the cerebral cortex? This is the internal capsule. Then medial to the internal capsule is this caudate nucleus, this one big structure you are seeing. Then lateral to internal capsule, I have a lens shaped nucleus, which is the lentiform nucleus. This is globus pallidus, this is putamen. Next to lentiform nucleus, you have this white thing, which is external capsule, and this yellow thing, sorry, the grayish thing that you see over here is the claustrum, and next white thing that you oversee is the extreme capsule. Okay, this is the extreme capsule, and this is the insular cortex. Okay, this is the insular cortex. Same thing on the other side also. This is the internal capsule. Here you see the caudate nucleus. Then you see this lens-shaped nucleus, which is lentiform nucleus containing the globus pallidus and putamen. Then the white matter bundle that is there is the external capsule, claustrum, extreme capsule, insular cortex, which we have already done this. I had already explained this in details. And these two rounded elevations I see is the mammillary body, and this blackish thing that we see is the substantia nigra. This is section at the level of the lentiform nucleus. Let's look at the cadaveric image of the same. Does it not look the same, guys? Does it not look the same? What was my rule? First, have a rough sketch. Then look at the atlas image. Then come to the cadaveric image. Then go to the cadaveric image. Let's try to mark the same structures. Now, what is first? Again, if you have a structure like this, if you have a section like this, mark the ventricles. What is this? This is the lateral ventricle. Then you see so many brown structures here, but there is something white in between these two. What is this white thing? This is the internal capsule. Then medial to the internal capsule is this nucleus, which is the caudate nucleus. Lateral to that is this. I have this lens-shaped nucleus that you can see over here, which is the lentiform nucleus, which has two structures, globus pallidus and putamen. Then I can see this white structure over here, which is the external capsule. Next to that, I have this brown thing that you see, which is the claustrum. Next to that, I have one more white thing, which is the extreme capsule. And this is the insular cortex. Same thing on the other side. I'm repeating it again, guys. This is the, let's just change the ink color. This is the lateral ventricle. Understood? And the fibers which are running to the opposite side, what are these? This is corpus callosum. This is the, what is this? Septum pellucidum. Then come to first always identify the internal capsule. This is the internal capsule. Once you identify the internal capsule, the one that is next to it becomes the caudate nucleus. Then this structure, which is lens shaped, becomes the lentiform nucleus. Can you see this white structure that you see next to the lentiform nucleus becomes the, this is the external capsule. Next to that, some line like this you can see is the claustrum. Then the white thing that you can see over here is the extreme capsule. This is the insular cortex. And you can see the mammillary bodies over here. Substantia nigra is not seen in this section. You can see the mammillary bodies. So this is a very important coronal section, guys. You will definitely be asked a question on this. You will see this cut section and they'll mark it and they'll ask you to identify what this structure is. Understood this? We've done this in the previous class. We have done an MRI section also, right? Now let's go to the third ventricle. Correct? Before that, let's try and understand this. We can see so many structures here. Let's try to identify each structure and then come to the third ventricle. What do we see? What section is this? This is the, what section is cutting the brain like this and seeing from this side? This is the sagittal section. In the sagittal section, what do we see? Predominant one structure that I can see here is the corpus callosum. One white matter bundle coming from the corpus callosum is the fornix. Fornix end in the, where do the fornix end? They have the anterior commissure which end in the mammillary bodies, which mammillary bodies are here actually. Fornix further ending into the anterior commissure. And this is the different parts of the corpus callosum is clearly seen, the rostrum, genu, splenium, and everything. Then what else do we see? See, what is there here? Optic chiasma. What else is there? Mammillary body. Are you trying to correlate something? In the previous, when one diagram we had studied about this, right? This is the optic chiasma, this is the tuber cinereum, infundibulum, then we have the mammillary bodies, then we have the third nerve. What is this? What is this I'm talking about? I'm talking about the interpeduncular fossa, guys. Whatever that you are seeing over here is exactly the interpeduncular fossa. The structures that you see, interpeduncular fossa, in this previous diagram, if you see, in the interpeduncular fossa, which I had shown, this particular area is from holding the brain and you're seeing from the below, in from the inferior angle. But the same when you take a section and see in the sagittal section, it looks like this. These are the interpeduncular fossa contents. What else do we see? We see cerebellum here. We see a part of midbrain. We see pons. We see medulla oblongata. I can see this aqueduct of Sylvius. And then I also see the floor of the fourth, I can see the fourth ventricle. I can see different cerebral cortical structures here. Parieto-occipital sulcus is seen. What else do we see? What else do we see? Anterior commissure is over. Frontal lobe, optic chiasma, you can see here. You can see the stalk of the pituitary. And this is the mammillary body. And here you can see the temporal lobe. Here you can see the cerebellum. A very, very important structure, guys, where you can identify so many structures. So in this, where is the third ventricle? Third ventricle is present here. This is the area where the third ventricle is present. Now, let's try to understand what are the different boundaries of the third ventricle. Look at this, guys. Look at this. This is the close-up picture where you can see where exactly is third ventricle. Okay, third ventricle is present in this area. This entire area that I'm pointing over here is the third ventricle. This entire thing is the third ventricle. Okay, if this is the third ventricle, let's try to understand the boundaries. So one that is present on the top is the roof. So these structures which are present over here form the roof. One that is present in the anterior wall becomes the anterior to this becomes the anterior wall. One that is present in the posterior as I don't know. I don't know what the issue is. Please let me share the screen. I'll just wrap it up in 5 minutes. Please share the screen.
try, ma'am.
Yeah, I'm able to share. Thank you. I don't know why the call is getting dropped today. Right, so these are the different boundaries of the third ventricle. Okay, yes, let's look at it again. So the anterior boundaries will be anterior commissure, lamina terminalis, and optic chiasma, whereas the roof forms the fornix, septum pellucidum, and corpus callosum, whereas the posterior boundaries will be formed by the posterior commissure, pineal gland, and also the tegmentum part of the mid brain. Okay, so basically in the third ventricle, what are the different boundaries that I can see? In the anterior wall, roof, posterior wall, and floor. In the floor, I've already told you it is the interpeduncular fossa contents which form the floor of the third ventricle, whereas anteriorly we have anterior commissure, lamina terminalis, optic chiasma. Posteriorly we have the posterior commissure, suprapineal recess, and on the roof we have the in an order we have the interventricular foramen, fornix, and corpus callosum. All right, guys. So that ends the today's session in which we have done different sections of the brain which are extremely important for us, and I hope all these 11-12 classes that we had taken for neuroanatomy are useful for you, and I hope you have learned something, and I really wish you guys all the very best, and if you have any doubts, you can always reach out to us across all our social media handles, and I wish you guys all the very best. And I hope today's class was useful, and the entire sessions that we're taking here at Auricle are useful to you for your revision, for your examination. All the very best, guys. And I wish you guys all the best. And if you have any doubts, please reach out to us. And thank you so much. Good night, guys. Thank you. Good night.